Burkina Faso confirmed its first coronavirus death, becoming the first fatality in sub-Saharan Africa. The 62-year-old woman had an underlying condition, diabetes. We now go to neighboring Ghana in Accra, where the SABC's Nabel Ahmed is waiting for us to speak to us about that particular case that has now been confirmed. We'll also be speaking to him in the next while about what Ghana is doing to respond to the COVID virus and how those measures are being implemented at the moment. You would remember as well that Ghana is heading for an election later on this year. The big question is the country starting to have the conversation around whether the elections themselves should be suspended? Let's try and get back to Nabel Ahmed, who is joining us. Good evening and welcome to African Perspective. What do we know about this woman who has now died, the 62-year-old from Burkina Faso?
Thank you very much. Yes, we know that she died today of the coronavirus, and she's been having the disease for some time now. What we are learning is that she's 62 years old and she was suffering from diabetes and has been in intensive care since she was detected positive of the coronavirus, and today she actually didn't survive the disease and she's actually gone. There are some who are saying on social media that she is a lawmaker, but then that has not been confirmed yet. But what we are seeing on social media is that she is a legislator, actually, Alvin.
Is it known at all whether she contracted the virus while being in the country or was she traveling?
What we understand is that it's actually an imported case. It wasn't something that she contracted whilst in the country. We understand that she actually came back from overseas, and that's when she was confirmed positive of the coronavirus. So this is one of the cases of the imported disease that we are having in the continent.
And let's then move on and speak about Ghana itself. How many cases have been confirmed so far? We're also seeing reports that there is at least 2 people from Anglo Gold Ashanti, if I'm not mistaken, that have been confirmed positive of COVID-19.
Yes, so far Ghana has 7 cases. It first recorded 2 cases, but now it has jumped to 7. Authorities have indicated that all the 7 cases, the patients are undergoing treatments and they are recovering fully. What we understand that we don't have any death at the moment, but then the 7 cases are in the hospitals, have been isolated, and they are receiving medical attention. Doctors are saying that they are responding to treatment as well.
Speak to us quickly about the 2 cases of Anglo Ashanti and what the company says it's doing in terms of trying to put in measures, because I understand there's also the issue around how many people may have come into contact with these 2 people.
Yes, with the Anglo Gold Ashanti, we are learning that these 2 cases were also imported. They also were outside the country and they returned with the disease. We had a statement from management of Anglo Gold Ashanti saying that once these people have been confirmed and tested positive, they actually had come into contact with some of the staff at the mines, and that contact tracing is being done, and also they are testing some of the staff that these 2 people may have come into contact with to test if indeed they have contracted the coronavirus disease or otherwise. But then all the staff have also been asked to go home, and also self-isolate while these tests are being conducted on them.
So as this self-isolation happens, what is the process that is then followed by the health authorities in the country?
So what we are learning is that because the health officials don't want people coming into the hospital with the disease if they do have it, because of course they would go through, they will pick transport, they would meet other people on their way to the hospital. So with those who have been seen to have come into contact with these 7 cases of the coronavirus have been asked to stay where they are. They would have to call the health service, and then health officials will actually move there, take their samples, and then send it to places for testing. In the Ashanti region, we know in Kumasi there is a testing center for the disease. So that's what's being done. These people are being asked to stay where they are. They shouldn't actually move, but then their samples would be taken by health officials in their homes or wherever they may be, and then the testing will be done to confirm or otherwise whether they have the disease, and then treatment would begin if there is a need to do so.
Speak to us quickly about some of the restrictions that have been announced by the president on Sunday.
Yes, so President Nana Akufo-Addo has placed a lot of restrictions. Schools have been shut. He's also asked people to social distance themselves. Social gatherings have been banned. Church services and Islamic programs have all been banned. On Sunday, we saw some churches have their last church services. This week, we are expecting that such congregation would not be held. The president has also said that his tightened travel restrictions to some countries that are hard hit by the coronavirus. So let's say if a particular country has more than 200 cases, flights coming from that country will not be allowed to touch down in Ghana. We already know that there are some people from China that are already being turned away when they are able to, come to the Kotoka International Airport.
Unfortunately, we're running out of time. Nabil, just quickly, unfortunately, we're running out of time. I just need to ask you this quick question. Has there been any conversation that's happening in the country, whether it is from the opposition side at least, that there should be a postponement of the elections which are scheduled for December?
That has not been come out yet, but we should know that Ghana was supposed to have its new registration for voters' ID card, voter registration in April. That the Electoral Commission has said has been suspended, but then a later date would be announced. But then for the election in December, no word has come out of it. We only know that the registration for the voters' ID card have been suspended. We are not going to have it in April.
Okay, Nabil Ahmed, thank you so much for your time. So that's the story that we have from West Africa. So when we come back, we'll be speaking to 2 MECs from this country, South Africa. We'll be speaking to the MEC from Limpopo as well as the MEC of Health from Gauteng.